Hello, and welcome to the Dance Physio Podcast, a podcast designed to explore ideas and foster discussion around dancer health and wellness. We're here to challenge the status quo, bridge the gap between dance science and the studio, and help change the landscape of the dance industry for the better. I'm your host, Erika Mayall, a dancer turned physiotherapist who is deeply passionate about leaving the dance world better than I found it. I'm so glad you're here. Let's get started. Hello, everyone, and welcome back to another episode of the Dance Physio Podcast. I am Erika Mayall, and just before we get started, I would encourage you to go and subscribe and like the podcast, download episodes, and if you're so inclined, leave a review. It really helps the podcast to be found by other people searching for similar information. So today we are going to dive into the topic of dancer screening assessment. So we're going to talk about what a dance screen assessment is, why dancers should have them, and a few other details like that. So some of you may be familiar with the concept of screening assessments. The most common one, especially from sort of the physio world, or it gets used in athletics or even like training settings with personal trainers and gyms and stuff, is the FMS, or the functional movement screen. So this screen has been around for a while, and it looks at some core functional tasks that they have the either patient or athlete or whoever's being tested do. So things like a squat or a hurdle step or things like that. And there's some specific parameters that they are looking at. So screening assessments are not unique to the dance world, and they have been around for a while. There's been a little bit of controversy around the sort of usefulness or practicality of screening assessments, and we're going to talk about that a little bit today when it comes to specifically dance screening assessments and why we would want to use them and the information that they sort of provide us with. But before we get into all that information, I just want to go through a little bit of what sort of a screening assessment, or specifically a dance screening assessment, should look like. So these screening assessments can happen in different settings, and often they are being done by healthcare providers. So it's quite common for physios to use screening assessment tools, but they can also be done in a studio setting, and that could be healthcare professionals coming into a studio setting to do them. I certainly have done plenty of screening assessments at studios. We'll often go in and do sort of like a day long and screen either groups of dancers or do them individually. And screening assessments can also be done by dance educators, and I'm going to talk about that a little bit more towards the end as well. So they don't always have to be done by a healthcare professional. So there's some components of a screening assessment that are going to be common between whether it's being performed by a healthcare practitioner or whether it's being performed by a dance educator, but then there might be some slight differences as well. So before we get into all of that, I'm just going to dive into what are the components of a sort of screen or a dance screening assessment. And these are going to vary a little bit depending on who's put together the screening assessment tool. But in general, these are the things that we want to be looking at. And so the screening assessment tool that I use both in my clinic and also if I'm going out into dance settings is one that I've developed over the years. So it's not one that is sort of one of the ones developed by different organizations, although there are ones like kind of more standardized. That's probably not the right word because they're not actually like truly standardized, but ones that have been developed by organizations. So components of a screen. The first thing that a dance screening assessment should have is a section where you're looking at the participant's dance history. So we want to know information about how long they've danced for, how old they were when they started dancing, different genres that they've participated in the past, genres they're currently participating in. That's also going to look at things like their current dance participation, how many hours they're training in a week. This gives us lots of different information that potentially can lead us to different outcomes in terms of what it is we're looking at. So when we look at kind of like how old was a dancer when they started dancing, it's pretty common for dancers to come in and, they were 2 or 3 years old when they started dancing. How early did they specialize in dance? Is dance the only activity they've ever participated in? And by the time they were 6 or 7, they were dancing full time and that was the only activity that they were doing. So we call that early sport specialization. And that's a really important thing to know because we know that people who specialize early in sports are at a higher risk of injuries. So we want to know information like that. we also, like I said, want to know what their current dance participation is like. So if we have dancers who are dancing really, really high training loads, that gives us some ideas of areas we might need to discuss with them or things we might need to look at in terms of their training program. And we also want to know what genres or styles they're training in currently. So if we have a dancer who's training 20 hours a week in only ballet, that is going to be different than a dancer who's training 20 hours a week, but might be dancing a variety of genres. So they're doing tap and they're doing musical theater and stage and ballet and jazz and all sorts of different genres. So it just gives us different information about kind of where a dancer might be or where some of their injury risks might lie, given their past and current dance participation. And this information is really, really important for us to gather. And this information you are not going to find on a more traditional sort of functional movement screen like an FMS or one that's designed for more athletic populations. So this is where it becomes really important to have a dance-specific screening tool that's being used rather than just sort of a sport-specific one that's trying to be adapted for dance, because there are a lot of differences between athletic populations and a dance population. We also want to make sure that we have a health history as part of this screening tool. So if dancers are experiencing any chronic health conditions, things like asthma, diabetes, long COVID's a big one right now, because we work with a population where there's a higher incidence of hypermobility among dancers, we also want to ask some hypermobility type screening questions. There is a big correlation between hypermobility and some other conditions such as POTS or other things like that. So it's really important that we get a good health history of our dancers from a very dance-specific lens. So again, a good screening tool for any population is going to probably have a health history section on it, but for dancers, those questions might be a little bit different. One of the other questions that's really important to include in the health history part of things is sleep questions. So are our dancers sleeping enough? Are they getting sort of the required amount of sleep? If they're not, what are the reasons for that? Are they simply not going to bed in time and spending enough time like in bed to get the correct number of hours? Or do they actually have problems either falling asleep or problems staying asleep? Because that's really problematic and something we want to look at addressing if that is something that's showing up. So we definitely want to know their sleep kind of patterns and sleep history. And the other thing that's really, really important that we cover with dancers is questions related to, if the dancer is female, we want to ask questions related to menstrual cycle. And this can give us really good information about whether a dancer is potentially vulnerable to something like Red S. And this is a topic that I'll probably dive into on a different podcast because it, requires its own kind of episode all on its own because it's so detailed and in-depth. But Red S is that relative energy deficiency in sport. So in these health questions, we want to know, is this athlete or is this dancer potentially susceptible to these types of things where maybe they're not fueling themselves adequately to sustain the performance that they are participating in. So there's all sorts of different health history questions that are going to be included in our screening tool. Then the next section that's really, really important for us to cover is their injury history. So we know one of the biggest predictors of whether a dancer is going to sustain an injury is whether they have had an injury in the past. And that does not have to be the same injury. So just because a dancer's had a sprained ankle doesn't necessarily mean that they will suffer from another sprained ankle, but they are higher risk for sustaining any type of subsequent injury. So maybe then it's a hamstring pull or tweaking their low back or whatever you want. We know that one of the predictors of injury is history of past injuries. So we want to ask lots of in-depth information about that. And with dancers, this question you sometimes have to be quite nuanced with, because if you just ask them, have you had any injuries in the past? They will often respond no. And so I think in the dance world, there's this perception that unless an injury is a really major injury, like they've broken a bone or something like that, that they don't really count as injuries. So sometimes it's important to make sure we phrase this question a little bit differently. And, I'll often talk about, aches and pains or physical complaints that have made them modify the dance they're participating in, or things that kind of bother them. Because when we start to use language like that, dancers will be like, oh yeah, I've had this hip thing for like years and I just kind of ignore it and I dance through it. And it's not necessarily something that they classify as an injury. But from a screening perspective, when we're looking at, okay, where are they in terms of like the health of their body, those things are things that are vitally important for us to know, because chances are, especially if it's something they've been dealing with for years, it's probably impacting their movement and their function in other parts of their body as well. So with these questions, like I said, in a dance-specific population, you really need to be a little bit nuanced or dig a little bit deeper into how you're asking this question. Because if you're just saying, have you had an injury in the past, a lot of dancers are going to reply no to that question. The other one that I find that dancers don't often classify as an injury, but again is really important to how they're functioning and their overall well-being, is asking about concussions or head injuries. Because if we ask about injuries, dancers will sometimes be like, oh yeah, I injured my knee and I had a back thing. But they don't always think about concussions as part of this kind of injury thing. And I don't know if that's the same in other athletes, but certainly dancers seem to have a bit of a disconnect between things that are more kind of brain health related and what they would consider sort of an injury in their body. So again, we just have to dig a little bit deeper in a dance-specific screening assessment to make sure that we're getting all of that information that we need in terms of being able to evaluate their overall health and well-being. So those are more of the kind of subjective parts of the assessment that you want to make sure that a dance-specific screening assessment covers. And then we look, or sort of move into the more, like I kind of think of it more as like the movement part of the assessment, or like, again, like this is often called like the functional part, but I would argue that that's only one component of the like kind of objective or more movement part of the assessment. So for a dance-specific assessment, we want to definitely make sure that there is a section of the assessment that's looking at just general alignment. And one of the things we're really specifically looking for or screening for in a dance-specific screening assessment is the presence of scoliosis. So that's like a curvature that's happening in the spine, either sort of a C-shaped curve or an S-shaped curve. We know that there is a higher rate of scoliosis among dancers than non-dancers. And again, this could be like its kind of own podcast episode, and I won't dive into it too much right now. But oftentimes these screening assessments are the first time that this scoliosis is being kind of identified or recognized in a dancer. And the earlier we can identify these, the sooner we can look at sort of further investigations or interventions in terms of what is it that we want to do about this scoliosis, or like monitoring and that sort of stuff. So when we're looking at alignment, we're really looking for those sort of like bigger red flag things. Are we looking for like minor asymmetries from side to side, things like that? Maybe not as much. Sometimes we do pick up on some of those things, and structurally we might notice a difference that, you know, the shape of a foot on one side might be different than the other, or things that are like good for us to like sort of notice. But whether they have a lot of clinical significance may or may not sort of be apparent through just looking at alignment. But again, specifically for dancers, we really want to make sure that that alignment assessment is like screening for scoliosis. We want to make sure that our screening assessment also includes an assessment of mobility. And specifically, we're looking at mobility in terms of, again, kind of symmetry of mobility. Or do we have a dancer who's really, really, really mobile through their spine, but not as mobile through, say, their hips or their knees or areas? So do we have relative areas of like higher mobility and relative areas of lower mobility? We also look at mobility sort of side to side. So again, if we're looking at, say, hip mobility, do they have huge amounts of mobility in one hip and the other one is quite limited, either in all directions or maybe just in one direction? Maybe they're lacking external rotation or turnout in one hip versus the other. So we're looking, again, more for symmetry or sort of areas of relative mobility, like sort of compared to other areas. We don't necessarily need to make judgments in terms of like, you know, is this dancer's mobility adequate or inadequate or things like that off of a screening assessment, but we're looking for more of these comparisons of symmetry and relative mobility compared to other areas of the body. We also want to take note, again, like I said, dancers, we tend to see a higher proportion of hypermobile dancers, and a screening assessment is one of the best ways to be able to try and pick up on that. So there are specific hypermobility assessment tools that we can use, and some of those are often embedded within a dancer screening assessment. So we might include like a Baton score or something within a dancer screening assessment, but we can also just get a really good idea of their general mobility through other mobility screens that we're looking at. And we want to make sure that we're including all areas of the body when we're looking at mobility. So spinal mobility, lower extremity mobility, upper extremity mobility, all of that. The next area we are going to look at is we're going to look at strength. So we're again looking at strength relative to other areas of the body. So if I'm assessing a dancer who's maybe like 10 years old and just starting to increase their hours and maybe just starting a competitive dance program versus a dancer who's 16, has been dancing competitively for the past 10 years, I expect their strength to be very, very different. So when we're doing a strength assessment, we're looking at where is their strength relative to where we would expect it to be at for their age, for their developmental level, for the level that they're dancing at, all of those things. And then again, we're also looking for symmetry side to side. Do we see that one side has a weakness in whatever muscle group, say their hip flexors or their glute muscles or whatever, what have you, compared to the other side, because sometimes that gives us information about perhaps their preferred training side or their past injury history. If they had an ankle sprain on one side, maybe they've never fully recovered their strength up that side in terms of like the kind of kinetic chain. So we're again looking for kind of overall strength, but also strength kind of side to side or like relatively compared to other areas, and that sort of symmetry of strength. We want to make sure that we include what I would call functional movements. And these are not necessarily dance functional movements, because that's going to come up in the last section, but these are like human being functional movements. So these would be things that would be more commonly assessed on like an athletic functional screen, or one that you might, like a screening assessment you might see done with a more general population or athletic population. But these would be things like a squat. Can our dancers perform a squat? Can our dancers perform a hip hinge movement? Things like that. Really functional movements that we should be able to accomplish in day-to-day life that we often find our dancers really struggle with because they're so patterned and programmed into dance-specific movements. So we want to make sure that our screen includes some just general functional movements or kind of human movements. And then we also want to include, and I kind of usually call this section like the technique sort of section of it, we want to include some dance-specific functional movements. So I'm looking at these from kind of a technique perspective, but they're also giving us information about perhaps if there's mobility limitations or weaknesses or things like that. And so those could be things, again, depending on what style your dancer is dancing in. Maybe we're looking at a plie, maybe we're looking at a forward port-de-bras type movement, whatever it happens to be. But those are going to be your dance-specific functional movements, or again, I call those just kind of like technique and looking at those movements. So those are sort of the main components of a dance-specific screening assessment. And so you can see that like there's a lot of different things that can go into that in terms of the history that we're taking and then the kind of movement things that we're looking at. And this is why it's often really important that it is dance specific when we're doing it, because you can kind of get the gist from that it's not going to be exactly the same as a screening assessment that we would do in kind of general population or in an athletic population. So you really do want somebody who's really specifically looking at a dancer population when they're doing these screening assessments. So why do we want to do a screen? I kind of alluded to this a little bit at the beginning, but I just want to dive a bit deeper into kind of like, what is the purpose of these screening assessments? What are we hoping to gain from them? And one of the reasons why the FMS kind of has been a bit controversial over the years and sort of was really popular and then fell out of favor a little bit is that there was this idea when it first came out that it was going to be this really amazing injury prevention tool. So we were going to do these functional screening assessments, and then we were going to be able to predict all of these injuries that people were going to have, and we'd be able to create interventions and prevent these injuries. And this was kind of the idea within dancer screens maybe initially as well. But over time and just with research and things like that, we know that we can't actually predict injuries, and we certainly cannot predict them from screening assessments. So we get all sorts of good information from a screening assessment, but it does not tell us who is more or less likely to become injured. We may be able to sort of, in certain cases, say, okay, because of this weakness that's here, you're going to be more vulnerable to X, Y, Z. But when we actually look at it from a research perspective, we cannot actually predict who will or will not get injured. So we don't necessarily use screening assessments as an injury prevention tool. And that's kind of, again, where some of this, like, I don't know if controversy is the right word, but why people were like, well, then these screens are useless. And that's not at all true. Just because it doesn't do one thing that, maybe people thought like was going to be kind of its value doesn't mean it's not useful. And so the way I sort of look at a screening assessment is that it gives us an opportunity to look at areas for performance enhancement. So especially in dancers, like dancers constantly want to get better. They're always looking to improve. You always want to improve your technique. You always want to improve areas of your dancing. And so that's really the value in a screening assessment, is it gives us that information. So if we identify, say, a weakness in, I don't know, let's say hip flexors in a dancer. Well, we know that perhaps if we, implement an intervention to work on strengthening their hip flexors, and especially strengthening their hip flexors in end of range movements, that we're going to help that dancer increase their leg height or their extension heights while they're dancing. So we can use this information to then sort of help dancers work on areas that they might need to improve on. Again, one of the biggest things we pick up on screens is this kind of like asymmetry from side to side. And I can almost always pick out what a dancer's sort of quote unquote preferred side is, what their turning leg is, what their extension leg is, just based on what we find on these screens. And the more those imbalances develop, so if we just let dancers continue to train on their sort of preferred side and not kind of address these imbalances, we are going to set them up for problems later on down the road in terms of like one side getting stronger and one side getting weaker and things like that. So if we can identify those out of a screen, we can implement programs to work on addressing those asymmetries from side to side. So we really like to think of a screen as much more of a sort of performance enhancement tool rather than just an injury prevention tool. Although, like I said, in some cases, maybe we can look at things that might contribute to injury prevention. We cannot sort of guarantee that, and that is not what the research shows us. The other really, really big benefit of doing a screening assessment, especially if we can do screening assessments on dancers regularly, and I'll talk about that in a second, is that we get baseline measures. So for dancers that I work with regularly and that we do screening with regularly, if they then happen to have an injury later on that season or sort of in the future, we can look back at their screen and say, okay, this was where your strength was originally, or this is what your mobility in this area was originally. And so we have these baseline measures that we can sort of aim to work towards as we're going through sort of like injury recovery. It's not absolutely critical that we have this information. I certainly work with dancers all the time who I've not seen prior to them having an injury. The first time they attend physio is when they actually do have an injury. But for dancers who we have that screening information, it really is super helpful to then be able to use that as baselines to get back to if they are going through sort of the rehabilitation process. And this is much the same as like kind of like fitness testing or stuff that's done in other athletic populations. Like professional athletes will go through fitness testing throughout the season, and then they can use those parameters and say, okay, your peak speed is this normally. We need to get you back within 90% of that before you can return to play and things like that. So it just gives us really good information as we go through the rehab process to make sure that we're returning dancers back to what their kind of baseline function was. So that kind of leads into the question of like, when should dancers be getting screening assessments done? How often? Things like that. And this is going to vary a little bit depending on what type of a setting your dancer is in and age and all of those types of things. So with younger dancers, and I work a lot with adolescent dancers, before they hit sort of puberty, so when they're younger, I usually like to say that it's great if we can to get our first screening assessment done around age 10-ish. It's nice to have markers before dancers start to go through their big adolescent growth spurt. And assuming they've never had any injuries in the past or any issues, usually around 10 is a great time to sort of do that first screening assessment. And then I'll often recommend that dancers, again, this is assuming they've not had any injuries or issues, is that they get it done annually until they hit that adolescent growth spurt. So depending on what age that's happening, that might be once a year for, say, 2 years or something until they start to hit that adolescent growth spurt. When dancers are going through their really kind of rapid period of growth and things are changing really rapidly during that adolescent growth spurt, we often will recommend that they get them done a little bit more frequently than that. So, a lot of times we'll say like once every 6 months just to kind of check in on things. If there's anything that's, sort of big red flags, then obviously we're going to follow up and continue to monitor those dancers or even work with them on intervention programs and things like that. But if we're doing this purely as a screening tool, purely for like the information for performance enhancement and to have baseline measures, then usually every 6 months or so until that adolescent growth spurt sort of finishes or starts to taper off. And then again, we kind of go back to the like once a year or once a season sort of screening. I always like to do screens kind of in like preseason if we can. Again, this is sort of like really similar to athletic or sports populations that will often have these kind of preseason screens done. But again, it's not necessarily like required that it be a preseason thing. Sometimes I get dancers who we do it like right in the middle of the season or at the end of a season. It just really depends on what works out scheduling wise. But ideally, if we can have them done once a year, sort of in those age groups, unless it's that adolescent growth spurt, and then usually a bit more frequently than that. In a more professional dance kind of setting, so if we have dancers who are dancing in professional companies and things like that, again, we want to make sure we're doing them like at least annually or like once per season. But sometimes it's also useful to go through and do screens if they're doing like a really big change in repertoire or style that they're doing. So if you have dancers who, it's a classical ballet company, but all of a sudden they're doing a contemporary work that has like incredibly different physical demands than, what their repertoire would normally be, then sometimes it's really useful to do a screen again before they start to change kind of styles or like their repertoire that they're working on to identify if there's maybe areas that need to be improved upon as they start to move their bodies in different ways. So sometimes it becomes a little bit more kind of like repertoire specific as opposed to just like a timing thing when we're working with more kind of professional dancers. But those are sort of our general guidelines of when we would want our dancers to have kind of a screening assessment done. And so that kind of brings me to sort of the conclusion. And like I said at the beginning, a lot of times these screens are done by healthcare professionals and they can be done on an individual basis in the clinic. And so again, this is what we spend a lot of our time doing in the clinic is having dancers come in for screening assessments, but they can be done in a group setting as well. And there's actually a screening tool that has been developed by Healthy Dancer Canada, a little plug for them right here. They've actually developed 2 screening tools. So they do have one that's specific for healthcare practitioners. So if you are a healthcare practitioner, like a physiotherapist, and you're wanting to get into dancer screens, but you don't want to develop your own screening tool, they do have a screening tool specifically for healthcare practitioners that's available to their members. But they've also developed one that is for dance educators. And so this is a dance screening tool that would be appropriate to use like in the classroom setting and is appropriate for dance teachers to actually implement this screening tool. It can be done, it's designed to be done on an individual basis as well. So you'd be working one-on-one with your dancer to do it. But I have used it in group settings before as well. And you can kind of set up stations throughout the studio and have like the different components of it being done at different stations in through there. So it's a really great tool if you are a dance educator and you are maybe interested in implementing dancer screening programs, but you're not quite sure how to go about doing it, or you don't have healthcare practitioners in your community who can support you in this, then that Healthy Dancer Canada tool is really fantastic for that. So you can find both of their screening tools on the Healthy Dancer Canada website, which I believe is healthydancercanada.org. I will pop it into the show notes, the website link, and those screening tools are available for members there.
So yeah, if you are interested in more information about screening, I'd highly, highly suggest checking out those resources there. And if you have any questions specifically about anything we talked about in this podcast today with regards to screening tools in terms of what they should incorporate, when we would do them, why we're doing them, all of that stuff, please let me know. You can send me an email, send me a DM. And again, just a final reminder to like and subscribe. And if you can, please, please, please leave us a review on whatever podcast platform you are listening on. Thanks so much.